skincare for babies can be really, really confusing. I remember when we had a kid and he was just born. Luckily, the skincare scene was sorted because I'm a dermatologist, but the rest of it, we were so clueless, we didn't even know how to hold him. So we were just so clueless with what do you do with this baby? And our natural tendency is to just go back and, ask our moms what they did. Now, while what they tell us is usually right, sometimes it can really go wrong. I had so many people coming and telling me, despite being a dermatologist, I had so many people coming and telling me, ye lagao, wo lagao, this is good for your baby's skin. And it's not. And I know that factually, scientifically. And they feel no hesitance to come and tell me that this is what you need to put on your baby's skin. So I'm here to break this down for you and tell you what you need to do to take care of your baby's skin. So let's get into it. So for your baby's bath time, make sure the baths are really small. You don't use very hot water. When you're choosing a cleanser, look for a mild, very gentle, fragrance-free, almost moisturizing cleanser or a Sindead bar. Recommendations down here. And if your baby has very dry, eczema-prone skin, use very little cleanser. Maybe use just a few drops of cleanser only to clean the really dirty areas like, your baby's butt, maybe the hands and the feet, just those areas. You do not need to use soap on the rest of your baby's skin. Next, moisturize right after your baby's bath. That's very, very important. You need to lock all of that moisture and hydration in. Now, I do not recommend using baby oils or any sort of oils to massage your baby. Use the baby lotion to give your baby a massage. The massage is great, but do not use oils. We see a lot of babies, particularly in our kind of weather. We see a lot of babies coming in with seborrheic dermatitis or worsening diaper rashes because of the amount of oil that we put on their skin. And seborrheic dermatitis is extremely common in babies. So really do not use an oil. Use a baby lotion to massage your baby's skin. And a great time to do it is right after your baby's bath. It'll also help your baby sleep better, which always works. Who doesn't want their baby to sleep? Next, coming to baby shampoos. Now, when your baby is newborn and barely has any hair on its head, you don't really need to shampoo it too much. But once your baby is a little older and there is some significant hair and you want to start shampooing, you need to use a no-tear shampoo or a baby shampoo. Now, baby shampoos are different from adult shampoos because they don't irritate the eyes if they accidentally enter your eyes. That doesn't mean that baby shampoos are milder than adult shampoos. So when adults start using baby shampoos thinking they're mild, I see a lot of people with a hair fall doing this. These shampoos are actually harsher on your hair. They make your hair frizzier. So we're not using it on babies to improve their hair texture. We're using it on babies so it doesn't irritate their eyes. So even when your babies grow up and they're older kids, the moment they start being able to keep the eyes shut during the shower time, you can actually stop using these baby shampoos and switch to adult shampoos so their hair turns out a little softer, right? Okay, my next point of contention is wrapping up your babies. I don't know, I see so many adults swaddling their babies in these super warm woolen cloths and it's too much. Your baby also feels hot. I know babies are prone to hypothermia, but you don't need to burn them out in all of those blankets. So go easy on the swaddling. Don't swaddle them too much. Assess how hot it really is or how cold it really is. Of course, in a cold place or if you're sitting in the AC, you need to cover them up. But if not, we live in India, it's already hot. Just a small, light cotton swaddle is enough. Don't overdo it, please. Next, coming to sunscreens. Now, newborn babies are really not stepping out in the sun too much. So you do not need a sunscreen. It's also not advisable to use a sunscreen on your baby's skin because their skin barriers aren't that well developed and there is a significant risk of absorption of sunscreen filters. So for the first 6 months, we absolutely do not recommend using any sunscreen at all. I'm sorry, I have a pretty bad cold. So just bear with all the sniffing as we go through this video. So coming back to sunscreens. Now, we recommend sunscreens for babies only after the age of 6 months. Even after the age of 6 months, stick to only physical sunscreens or mineral-based sunscreens that contain zinc oxide or titanium dioxide. So there is no risk of your baby accidentally, absorbing those chemical filters through its skin because we don't know the safety profile yet. In saying that, would I ask you to be putting sunscreen on your baby every day, even if it's post 6 months of age? Probably not. Stick to physical modes of protection like clothes, hats, umbrellas, all of that. Use sunscreens only when your baby is going to be majorly out there, like you're at the beach, then yes, use a physical sunscreen. But on a day-to-day basis, I don't think you need to burden our kids too much with using too much of sunscreen. Of course, this is a little different for Caucasians who have very significantly higher risks of skin cancer. But in Indian babies, I think we can let that go. Stick to using sunscreens only when your baby's going swimming or at the beach or super hot afternoon sun exposure. If you want some recommendations for physical sunscreens that your baby can use, again, I have put them up here and you can also check them out in the caption. Now coming to dealing with a diaper rash, let me just put it out there. Your baby's bottom is really cute. It does not need talcum powder, and your baby's lungs are very precious. It does not need talcum powder either. Now the deal is that first of all, talcum powder can worsen any diaper rash that your baby might already have. Any irritation in your skin can get worsened by talcum powder. The second thing to note is that talcum powder can worsen respiratory issues, and our babies have more and plenty and enough of respiratory issues already given the status of the pollution in our country. So let's keep that talcum powder exposure to a minimum. I remember my son, he's now 4, but growing up, he had so many respiratory issues constantly. He was a COVID baby, and all of his friends who were also COVID babies, at some point or the other, growing up in their lives, have been put on inhalers or nebulizers, and it just breaks my heart to see what is happening to today's kids. So at least let's reduce the exposure that we provide them with talcum powder. So what should you do? One is, after every poop or pee episode, make sure you clean the area really nicely with a soft cotton pad or a cotton wipe or a cotton cloth if you don't want to use disposables. Make sure it's wet though, warm, slightly warm and wet. Do not use dry tissues or cloth in this area because it has a very harsh and abrasive effect. So it'll sort of, strip that area a little more. So let's make sure to avoid that. What should you do after every wipe is let the area dry out nicely. Maybe give it some time to just, let the skin out there breathe, let it get aerated. That's very important. And after that, put a little bit of diaper rash cream. Now, these diaper rash creams are zinc oxide based creams. They're thick, a little greasy, honestly, but it's fine. It really helps the skin heal. It helps with a great anti-inflammatory action on all of that area. And your baby's butt is going to be very happy with you. The next question that a lot of new moms keep asking me is, should we allow their dadis and their nannies to put kajal on the eyes and to put that kala tika or to put surma in the eyes? Now, honestly, I know this is an age-old custom, and of course, we've probably had it done to us and nothing happened to us, but the quality of the kajal, the quality of the surma also really matters. How it is made is usually it contains lead. Now, lead is toxic. You do not want lead going into your baby's system. It's positively toxic. When we're so careful about the creams that we put on our baby because it's all Western and modern, and we're so against putting anything on our baby's skin, why are we so okay with lead being put on our baby's skins? So I personally really do not recommend it. But if you absolutely must, if it is a cultural requirement that you absolutely have to do it, the one thing I would request you is do not at least put it anywhere close to the eyes. So do not do the kajal and the surma in the eyes thing at all. Not just for the lead, but also the risk of infections in the eyes. So definitely avoid that area. If you must, do it a little further away, maybe back of the ear or something like that for the kala tika. I'm sorry to all the dadis and nannies, but it's a fact. I really can't help it. The next big myth about baby's hair is shaving the baby's hair. Mundan karna. I think it's really cute. It's a very cute practice to do, but it is not a must. It is not going to make your baby's hair grow thicker. Frankly, shaving a baby's hair or trimming a baby's hair is just like cutting it. Cutting your hair doesn't make it thicker, right? It maybe cuts off the split ends. Now, do you need to shave your baby's hair? No, you really do not need to. It does not affect the baby's regrown hair in any way because it's a very superficial thing that's happening, and your baby is going to grow beautiful hair by the time it's a year or two old anyway, so don't worry too much about it. Now, there are a couple of things that people freak out when they see on their baby, which is absolutely normal. For example, lanugo hair, which is fine, really soft hair all over the baby's body, particularly on the shoulders. Now, this is hair that is normally present in every baby while it's inside the uterus.
Now, if your baby is born a little early, a little preterm, it's very likely that it'll come out with that lanugo hair. But it's normal and you don't need to do anything about it. Don't try to shave it or wax it or anything. It is going to go off on its own in a couple of weeks. The next thing is melia, which is these tiny whitish bumps typically present in this area on a baby's face. Again, completely normal. It's just an obstruction of the sweat glands there. Goes off on its own in a couple of weeks at best. Then comes a Mongolian spot, which is this bluish, grayish spot on the lower back of the babies near the sacral area. Sometimes it could have a little bit of hair over it. Now, again, this is going to go away on its own. You don't need to do anything about it. It may sometimes persist up to teenage years, but by then it definitely goes away. So do not worry about these three guys. I hope this video was helpful. You can share it with all the new moms and dads out there who are going to freak out about their baby's skin problems. If you like this video, do give it a like and hit the subscribe button. It would mean a lot to us.